New cases of coronavirus are exploding all over the world, and markets are reacting badly. And I'm going to tell you in this episode what the CDC has in plans for how to manage a pandemic. Hello, everyone. This is Chris Martenson. This is your COVID-19 update for February 28th, 2020. I'm titling this one, On Your Own. You will be on your own because that kind of summarizes what the CDC has in mind for when a full-blown pandemic gets rolling. But you know what? I don't like the name COVID-19. Let's call this the honey badger virus. It don't care. It's just, you can see here, it's got the spike proteins right here and here. This is how it gains entrance into your domicile, and it's just coming. I just have to interject a little levity into this because it's getting so serious here. We look at the cases now. I think China has managed to contain its cases fairly well, but at what cost? Of course, it had to shut down most of its economy to do that, and now it's going to try and let the foot off the brake a little bit and see what happens there. Excuse me. South Korea, struggling, really working hard to try and contain this, but having a lot of trouble. Still don't understand the 7 serious critical over here. Doesn't make a bit of sense to me. Something's wrong with these two numbers here. This has got to be a lot higher. Italy, also struggling to contain. These numbers feel about right with the serious critical. That number should be larger than this during the growth phase of this. So this doesn't make sense to me. And total deaths now at 21. And then we've got Iran here claiming 34 deaths at this point in time and 143 new cases. BBC said they think maybe they've had, I forget what the number was, like 180 deaths or something like that. Iran disputes that. Whatevs. And the fact that there's nobody serious or critical is just wrong. That absolutely can't be the case. Japan, more and more, particularly in the Hokkaido province, things are coming on. I do believe Singapore's got a good handle on everything here. That makes a lot of sense. This, I don't believe even slightly. Germany, moving up quickly now. So we're starting to see cases all over the place. In fact, we're in 59 countries now. You got to look at all these lists. We have to go down through all of these countries now. When we started doing this, it was just a handful of countries. And now, of course, we're all over the map with all of this in all over the world. So let's get into some of that. The new cases, we have Iceland reporting its first case of coronavirus. Mexico, its first case, I believe that's up to 2 now. A couple more hotels in Abu Dhabi put in lockdown after 2 Italians tested positive for coronavirus, guests being screened. But of course, the screening doesn't really help because you could be asymptomatic, of course, as we all know, for up to 27 days. But with 14 being it's pretty common to be asymptomatic for that long. Azerbaijan, first case. They closed their border with Iran a long time ago, but that's popping up here. Now we see 143 new cases here, 8 new deaths. This is what Iran is reporting. Way too low. I think they have tens of thousands of cases because of all the cases they've managed to export already. Italy, 233 new cases of coronavirus, 4 new deaths, 888 cases, 21 deaths. So, and that's pretty recent. Lithuania reporting its first case of the coronavirus. Nigeria reporting its first case of the coronavirus. So if this busts into Africa, hopefully the hot weather is going to stop this thing dead, just like it has in other places. But we will see. South Korea. We talked about that just a little bit, 2,300 cases now, so we've already seen that number. Amsterdam reporting its first case of the coronavirus, second case in the Netherlands. Wales, first case coming up. And the French minister said several clusters of coronavirus identified, 19 new cases today, received a lot of really good inside information from people in many of these countries, sending me private emails, one from France today, just really decrying how much the French are behind the curve on this one and sounding a lot like the lame response that we're seeing in many other countries where the first official response is to hide things, cover them up, pretend things aren't that bad as a first order of business rather than just getting on with it. All right, a lot of new reactions out there to all of this. So Switzerland banning all events with more than 1,000 people to prevent the spread of coronavirus. Hokkaido in northern Japan declares a state of emergency, urges people to stay at home this weekend. Probably that's going to extend out to next weekend too. Tokyo Disney Resort Universal Studios Japan will be closed for at least 2 weeks to prevent the spread of the coronavirus. French health minister advises people not to shake hands. Says coronavirus epidemic in France has entered a new stage. You know what? I think I'm going to take that on for myself to start doing the elbow bump from here on out. That makes a lot of sense. But for cultures that have a more intimate way of greeting, the cheek kisses or coming in close, you might want to take the French advice and not even shake hands. It's going to be awkward for some cultures, of course, to adjust. Lebanon closes schools across the country for at least 1 week, and the school closures, we're going to get into more of that because that's going to be happening in many more countries, I believe. CBS is temporarily suspending production of The Amazing Race, and all contestants, staff members are returning home. So this is just an anecdote of one case of one where we're seeing these sorts of reactions all over the place. The impact on business is going to be pretty large. I'm really sorry for all the people out there who are, very upset with a 4,000 point drop in the Dow, saying, but 80,000 flu deaths last year. Why and the Dow didn't fall? Why are people so freaked out about this? Well, they just don't understand the actual dimensions of the geometric spread of this, the lack of herd immunity. It's exceptionally high R0. It's very high case fatality rate, all things considered. Right, Italy. It didn't have as many cases coming up, but of course, you have to start paying attention to these things. They changed the counting on us here. So they changed the counting method to exclude any asymptomatic positives. So if you're going to, swab a bunch of people, swab all the contacts of somebody who has a confirmed case of the coronavirus, and thank you, Simone, for sending this article my way, then of course you're not going to catch these. You will, of course, find people who are positive but asymptomatic because it has a long incubation period, right? And that's part of the problem. It's not only got a long incubation period, but you can be infective during that process. So under what scenario could you imagine it makes sense to not count people who you've tested who are positive for this thing, knowing that it's asymptomatic and it takes a long time for the symptoms to progress? Well, that's only if you're trying to keep the numbers lower because you're worried about the impact on your tourist business, or there's some reason for that. So in the next few days, data on people affected by coronavirus in Italy will drop or remain stable after days of rapid growth. The change will not, however, probably and unfortunately, be due to a decrease in the circulation of the virus, but a new system of calculating cases from the Ministry of Health. They've already informed blah, 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 saying the idea of the ministry, therefore, is that of not communicating any asymptomatic cases to the international bodies that deal with the epidemic. That is, people who are positive to the swab but do not have any health problems. These infected represent between 40 and 50% of all cases reported at this time. With rare exceptions, they are followed to their home and cannot go out until they have a positive swab because they could still be contagious, blah, blah, blah. So this idea that they're just going to not count people who are testing positive and maybe just allow them to go home and self-quarantine doesn't make a lot of sense to me, but makes sense to certain health officials, I guess, in Italy right now, too. Hey, remember I kept talking about Thailand is just not making any sense to me. Like, I don't believe these numbers even slightly. Well, an alert follower sent me a chart that he had built off of the Thailand. This comes straight from actually Thailand's Ministry of Health. So thank you, SL, on this. And when you plot out their what they're calling viral pneumonia cases in Thailand, you get this chart. So I think this is just a case of changing the name. So you can change the counting, you can change the name. I'm convinced these are very much a very large outbreak of coronavirus here, the honey badger virus in Thailand. They're just refusing to call it as such. But, of course, these people do show up with viral pneumonia. And so that's what that would look like. So I think we have confirmation of that. Why do Iran's cases worry me so much? And I've mentioned this several times now, that I'm worried that Iran may have a different version of the virus because it seems to be so much more deadly. Of course, we have bad reporting out of Iran. So anyway, we don't know what to expect from there. But we have seen some people in this age bracket die so far. And the reason that's concerning is that based on all of the data we have so far, this should just be 0.2% death rates associated with these people. So that means out of every 500 people who get this, you would expect one death. And so seeing already 2 deaths here, either they have thousands of people at this age who are infected, or there's something different about this particular virus strain that's going on there. So I want to see that sequenced. This, again, still concerns me. But the overall shape, I think, is correct for what we know about the existing circulating coronavirus. It's really bad if you're a baby boomer and beyond. So this thing is when they say it has a 2% death rate, it's an average across all of these, which includes no fatalities 9 years and under, very low fatalities under the age of 39, and then it creeps up from there. So it's really high up on this end of things. It's probably circulating now in the United States. We had this in the New York Times. There was a whistleblower claimed a corrupt cover-up about the protections that were taken when people were brought into the Travis Air Force Base. So a complaint filed with Health and Human Services, promptly leaked to the New York Times, alleges that federal health employees interacted with Americans quarantined for possible coronavirus exposure without proper medical training or protective gear. Now, how is that even possible? In the New York Times article, it reads, the staff members were sent to Travis Air Force Base and March Air Reserve Base and were ordered to enter quarantined areas, including a hangar, where coronavirus evacuees were being received. They were not provided training and safety protocols until 5 days later. Without proper training or equipment, some of the exposed staff members moved freely around and off the bases, with at least one person staying at a nearby hotel and leaving California on a commercial flight. Many were unaware of the need to test their temperature 3 times a day. Well, forget even testing their temperature. The fact that you were exposed to people who were known to be infected and then were able to or allowed to or even did, because they should have been smarter than this themselves, get on a commercial flight and fly around, that's just not helpful. Now, you remember we had that case yesterday in California, which was the first community transfer case in the United States. That community transmission, let's just note here that Travis Air Force Base is right here, and if we take Nut Tree Road, it's only 7.5 miles to North Bay Vaca Hospital, which is, I sleuthed it out, that's the hospital where this woman was transferred to the UC Davis Hospital, which is 40 miles that way. So this is where that woman showed up with community-level transmission. So pretty good guess that it's endemic in this area at this point in time. All right, moving on. A couple of head shakers, scratchers here. So a WHO official today said if this was influenza, we would probably have called this a pandemic by now. But what we've seen with this virus is that containment measures work. What? And to declare a pandemic, it's unhelpful to do that when you're still trying to contain a disease. What? I don't even, I'm a pretty smart guy. I can't follow this. I don't understand how it's unhelpful to call something a pandemic. How does that harm your containment? I'm confused. There's a lot of things I don't understand. So here's a quick video from Dr. Redfield being asked some questions by Representative Chrissy Houlihan. And this just came from a couple days ago. Let's listen in to this. And we're going to have to remove that little piece right there that I just put on and start this playing. Let's go.
Should people be afraid? Thank you. Could you turn on your microphone? Should people engage in regular hand washing and coughing into their sleeves?
Absolutely.
Should people be stocking up on cleaning supplies?
No.
Should people be stocking up on prescription medications that they have?
Not at this time.
Should people be stocking up on food supply?
Not at this time.
Should you wear a mask if you're healthy?
No.
And is there a website, and you can answer this later if you don't know it by heart?
Hold on, this just got, there we go.
People can go to access good information about these questions.
Absolutely. The CDC, cdc.gov, we have all of the information on that website, and a sub-thing can take you to coronavirus and where we are and any preparedness and all our recommendations.
And sir,
all right. No, you should not wear masks. You shouldn't stock up on food. You shouldn't even buy any cleaning supplies. That's from a director at the CDC. I could not possibly disagree with any of that more. I think part of the reason the markets are reacting badly is because the United States, at least markets in the United States, is because the United States does not seem to have a legit plan. Here was the President of the United States coming out earlier today and saying this.
It's going to disappear. One day it's like a miracle. It will disappear.
One day it will disappear. It's like a miracle. It will disappear. Well, that's great. Interesting foresight there from President Trump. Not sure that I've studied any of that in any of epidemiology or virology journals. I'll have to crack those open and find out about that miracle disappearance thing. But in the meantime, it's going to take really good, hard work. Markets. This is kind of interesting here. So, we have these markets that are really, really strongly run by computers now, and they're so complicated, I'm worried that nobody really understands them. But a lot of people are thinking it's time for the Fed to do a big bailout, and there's a lot of excitement in the banking financial area that perhaps the Fed's going to throw more money into the markets and make the wealthy people wealthier. That's certainly something they could try. So with 2 former Fed officials, potentially 1 future Fed chair, opining that the Fed may announce an emergency rate cut as soon as this weekend, sinking traders desperate to grab hold to any stick have been scrambling all morning to create a rumor, or at least a rumor, that on Sunday night the Fed will step in. So the theory here is that the Fed cuts rates and this is more money and it should make stocks go up, and that makes everybody happier, and as long as they're happier, things are good. So let me ask you this. How much would the Fed have to cut rates for you to take a cruise right now? For me, it would be pretty far, and they don't have that much space to work with. But the part I really wanted to pick up on, too, here is picking up on this theme. Listen to this, though, if you can. Nomura's Charlie McElliott summarizes today's market action, writing that we are now going through dangerous times as, listen to this now, recently overwhelming dealer short gamma hedging into the down trade, mechanical systemic deleveraging, and dynamic shorting of futures are now at risk of a turn as equities downside/VIX upside hedges are increasingly likely to be monetized, creating violently squeezy flows in the equity market, which has recently been purged. Well, what? This is what our markets are now, though. That literally, they're this complicated and complex. So let me simplify. Markets aren't traders anymore. Here's a sad photo of Wall Street traders reacting as the stock market plunges. It's a very, very complex system now, and it has nothing to do with reality, and it got decoupled from reality, and it's all of this junk here. It's got a lot of that going on. Looking at it as well from the way economists are looking at this. Here's an economist speaking on CNBC Squawk Box. Michelle Garrard, chief U.S. economist at NatWest Markets, said, investors were currently focused on how the outbreak was disrupting supply chains. Hey, that's an actual legit concern. If Apple can't make iPhones, then you have a problem selling them, right? That's a legit concern. But what we're quickly shifting toward, which is far more worrisome, she says, is that it actually begins to have an effect on consumer demand and consumer behavior. For me in the States, that's probably the biggest thing to be watching. Claiming nothing in modern history had led to as many shutdowns and self-isolations as COVID-19, the honey badger virus. Gerard said that the magnitude of the spread could lead to a shift in mindsets. What I fear is you'll have people in the U.S. actually beginning to change their behavior to think, do I want to go to the movies? Do I want to go to a sporting event? Do I want to sit in big crowds? So it's the psychology change here as the virus begins to spread that's most worrisome for me. That's not my biggest worry. I think those are all perfectly appropriate things. What she's worried about is that people will not just consume like they've been consuming, and then what happens to the economy. Yes, but it's totally appropriate, Michelle, for people to actually change their behaviors in the face of a big risk like this. And so I'm actually hopeful that people will change their behaviors. I'm not worried about it. All right. Remember a while ago, just a few days ago, CDC said the coronavirus could cause severe disruption in America. I thought that was a little cryptic. And so what I did was managed to find, again, from a very helpful follower, they directed me to a 2007 study that was put out by the CDC, the same group that had that person saying, no, you shouldn't, yes, cough into your crook your elbow, but don't get any face masks, don't get any cleaning supplies, don't store up any food, don't stock any medications. Here's what the CDC is actually saying early on, and this is their interim pre-pandemic planning guidance community strategy for pandemic influenza mitigation, early targeted layered use of non-pharmaceutical interventions, NPI, non-pharmaceutical interventions. We'll get into that. Here's the link for this if you want to find it yourself. Okay, in this document, I want to go through a little bit carefully because I think it tells you what your future is going to look like. This is the thinking. It's very good thinking, actually. I actually agree with a lot of it. It runs totally counter to the actual public statements you just heard from the CDC official and also from President Trump. Reasonable goals. Right from their introduction, they said the goals of the federal government's response to pandemic influenza are to limit the spread of a pandemic. Hey, I'm with you on that. Mitigate disease. Yep. Suffering and death. Yep. Mitigate those two. And sustain infrastructure and lessen the impact on the economy and the functioning of society. Remember, these are those three things that you have to weight that we've been going over. Those are the three basic things that you have to measure and weigh against each other. Do you want to contain the virus? Do you want to save the economy? Or do you want to make sure and assure that your medical infrastructure isn't overwhelmed? Without mitigating interventions, even a less severe pandemic would likely result in dramatic increases in the number of hospitalizations and deaths. In addition, an unmitigated severe pandemic would likely overwhelm our nation's critical healthcare services and impose significant stress on our nation's critical infrastructure. So that's the third thing you have to balance is if you overwhelm everything, things get bad, your case fatality rates really spike. This guidance introduces for the first time a pandemic severity index in which the case fatality ratio, that is the proportion of deaths among the clinically ill persons, serves as the critical driver for categorizing the severity of a pandemic. I'm totally with them here. That's a great way to do it. That makes a lot of sense. The severity index is designed to enable better prediction of the impact of a pandemic and to provide local decision makers with recommendations that are matched to the severity of future influenza pandemics. Awesome. So far, so good. I'm right there with you. I like this. And I thought they had very reasonable framing on this whole thing, where they said it's highly unlikely that the most effective tool for mitigating a pandemic, that is a well-matched pandemic strain vaccine, will be available when a pandemic begins. Yep. Very unlikely. So that's what happened here. We have a pandemic, and we don't have not even a well-matched pandemic strain vaccine. We don't have any vaccine whatsoever. This means that we must be prepared to face the first wave of the next pandemic without vaccine and potentially without sufficient quantities of even influenza antiviral meds. That's absolutely the case here too. So they nailed this way back when. They thought this through and got it right. In addition, it's not known if influenza antiviral medications will be effective against a future pandemic strain. Here we're finding, I think some of them actually are. It's kind of a mixed bag. It's not a magic bullet, but some do work, and I'm not sure if we'll be able to make enough of them in time. That would be a concern here. During a pandemic, decisions about how to protect the public before an effective vaccine is available need to be based on scientific data, ethical considerations, consideration of the public's perspective of the protective measures and the impact on society, and common sense. I'd love some common sense, like, hey, maybe we should test people even if they haven't been to China, and we should detect community-level outbreaks before they get started. That would be common sense. So this part didn't make it into current thinking. Maybe somebody should reread this there. Evidence to determine the best strategies for protecting people during a pandemic is very limited, so we don't have a lot to go on, historically speaking. All right. They also set reasonable expectations in this document. All such community-based strategies should be used in combination with individual infection control measures such as hand washing and cough etiquette. So that's what Dr. Redfield was saying. He was all for the hand washing and cough etiquette, absolutely, but other things can extend into individual infection control measures, and that includes face masks for everyone, social distancing, all kinds of things. Implementing these interventions in a timely and coordinated fashion will require advanced planning. Yep. I don't think we did that here, so a little behind the ball on that one. Communities must be prepared for the cascading second and third order consequences of the intervention, such as increased workplace absenteeism related to child-minding responsibilities if schools dismiss students and child care programs close. So that's just one second order consequence. There are many other ones besides that. So they have a very logical rationale built into this document as well, and I liked it a lot. So the rationale for the proposed non-pharmaceutical interventions, NPIs, the use of NPIs for mitigating a community-wide epidemic has three major goals. 1, delay the exponential growth in incident cases and shift the epidemic curve to the right in order to buy time. 4, production and distribution of a well-matched pandemic strain vaccine. Yes, first goal, very logical. And this is the one I've been arguing for. This is why you wanted to put in travel bans as soon as possible. Thank you, WHO. You want to do very aggressive contact tracing. You want to do as much testing as you can to limit the community outbreaks, because as Iran and Italy, South Korea show you, once this thing gets out of that genie's out of the bottle, good luck. You have to give up containment, and you just have to go straight to mitigation. And that we're seeing that already. Another goal, decrease the epidemic peak. Yeah, that'd be great. Fewer people infected and on that first wave. And 3, reduce the total number of incident cases, thus reducing community morbidity and mortality. Ultimately, reducing the number of persons infected is a primary goal of pandemic planning. Great. So these NPIs, which we'll get to in a second, non-pharmaceutical interventions, may help reduce influenza, or in this case, coronavirus transmission by reducing contact between sick and uninfected persons, thereby reducing the number of infected persons. See, common sense. Doesn't that just make sense? Yeah, let's just keep the sick people and the not sick people away from each other. Sounds awesome. Reducing the number of persons infected will in turn lessen the need for healthcare services, yes, and minimize the impact that this all has. All right, so here's how they categorize this, and this to me is the bombshell in this particular report when they said they had this pandemic severity index, and a category 1, you have a case fatality ratio of less than 0.1%, so that's standard flu is around there. A category 2 would get you all the way up to 0.5%, and that would project number of deaths would have been somewhere between 90 and 450,000. But if it's a category 3, it's somewhere between 0.5 and less than 1%. So somewhere between 0.5 and 1%. You would expect 500,000 to 1 million deaths, somewhere in that zone. But if it's all the way between 1 and 2%, it's a Cat 4. Now we're talking between 1 and 1.8 million deaths, just rounding up here. But if it's over 2%, and there's strong possibility that the case fatality ratio of this particular beast is around there, you're looking at a lot of deaths, over 1.8 million. So this is, without any question, this is a Cat 5. All right, what are these non-pharmaceutical interventions, and why did I take you through all of this? It's because these NPIs are going to have a really big impact on your life when they get implemented. First, number 1, isolation and treatment as appropriate with influenza antiviral medications of all persons, confirmed or probable. So yeah, we're missing out on that part right now. Isolation may occur in the home or healthcare setting depending on the severity and or the current capacity of the healthcare infrastructure. So if you're swamped, you're going to be riding this out at home. And that's why I titled this one On Your Own, because there's a strong chance if this thing really comes ripping through, you're going to be asked to ride this out no matter how severely you have this thing. You may have to ride this out at home like a lot of people in China are having to do. 2, NPI number 2, non-pharmaceutical intervention 2, is voluntary home quarantine of members of households with confirmed or probable influenza cases. So if somebody in your house has it, the whole home gets quarantined, right? Voluntary. In consideration of combining this intervention with the prophylactic use of antiviral meds, if you've got them, providing sufficient quantities of effective medications exist. Oops, there you go. Yep. And a feasible means of distributing them is in place. So even if we have them, we might not be able to get them to you. So NPI 1 and 2 is we're going to isolate, we're going to home quarantine. Let's keep moving. Number 3 here is dismissal of students from schools, including public, private schools, colleges, universities. We've already seen that happen all over. This may be coming to your community, and you just need to be ready for it. And school-based activities, closure of child care programs, coupled with protecting children and teenagers through social distancing in the community to achieve reductions of out-of-school social contacts, community missing. So number 3, hey, we're going to get the kids all separated in parks. Kids are great at spreading diseases. Anybody who's been a parent like me knows just how true that is. NPI number 4 here is the use of social distancing measures to reduce contact between adults in the community workplace, including, for example, cancellation of large public gatherings, alteration of workplace environments and schedules to decrease social density, preserve a healthy workplace to the greatest extent possible without disrupting essential services, enable institution of workplace leave policies that align incentives and facilitate adherence with the NPIs outlined above. So a lot of workplaces are going to get closed down, particularly non-essential workplaces. Well, that's what we just saw with Disney's parks being closed in Japan, and with Sweden canceling any events with more than 1,000 people. Not sure where they cut it off there, but that's the case. And so the CDC, has a way of looking through this. Here are all those NPIs down here, the interventions by setting, voluntary isolation, quarantine, schools, adult workplace stuff. This is everything we just talked through. If it's a Cat 1, it's generally not recommended. Maybe home isolation for the ill is recommended. If it's a Cat 2 or 3, it's recommended. Might consider these things here. But if it's a 4 or 5, all of these are highly recommended right here. And when they say child social distancing, dismissal of students from schools, it's up to 12 weeks. Recommend up to 12 weeks or less than. But those are big closures. We've seen those same closures happen in China, in Hong Kong, in Japan, and increasingly, I think we're going to start seeing those elsewhere in Europe. So that's what that would look like. So I just want you to be ready for that, because a lot of people, I think, aren't mentally, physically, emotionally, financially ready for what could happen if their job is closed down. Not everybody gets to telecommute. That doesn't work for a lot of jobs. What do you do with people whose kids are home now all of a sudden, or out of childcare? Big impacts, right? So that just helps to demystify a little bit when they said could cause severe disruption. The CDC said that stuff. Nancy Messonnier of the CDC said that, knowing that they have this sort of model in their background that they're operating from, and that they have these sets of NPIs that they understand and are working around. All right, so you need to get ready for these things, for schools to be closed potentially, for large gatherings to be banned, for non-essential jobs to be furloughed or even terminated potentially, any and all supply chains disruptions, to end up furloughing workers for even if you're in an essential job, but if the supply chain means you don't have any stuff there, you might still get furloughed or let go. And home treatment of all but the critically ill, and even then, if it's bad enough, you'd have to question what that word means and whether that will happen. That's what I think people need to get ready for. I've had a lot of questions as well. I just want to cover this one quickly. Somebody asked me today, please also tell us how poor people sanitize these masks, as maybe you can't afford a bunch of them. And by the way, in the EU, it looks like in Germany, $30 for a single mask, 5 packs for $300. It's just insane right now. So my answer to that was, if you have them, the easiest and safest way to sanitize a mask is time. We know that other coronaviruses can only last a maximum of 9 days on a surface. So have 9 masks. Rotate them day by day if they're in short supply. If you soak them, I've seen people saying, should we soak this in baking soda and alcohol? Should I, dip it in kerosene or whatever? The weird things they're thinking of. I think soaking in any solvent risks loosening the weave of the mask and allowing larger particles to penetrate. I would not want to involve soaking as part of my mixture there. I mean, you could spray off the outside lightly with chlorine solution if you wanted to, but I wouldn't soak them. And then just wait out the max survival time for this honey badger virus here. That's my idea. Might work, might not. But I mean, listen, in an emergency, what are you going to do, right? So if you have only so many masks and you need to begin recycling them because there are no masks, and there are none. These are almost impossible to find in many areas of the world right now. So if you don't have them and you have to recycle them, there's an idea for you. All right, our conclusions for today. We now have this in 59 countries, and every country where you see it with just a 1 or a 2 or a 3, the experience is that's what it's going to look like for the next 2 or 3 weeks. It'll be climbing up to 4, 6, 8, but then things really take off, and you get one of those charts that looks like that. The U.S. case count, totally statistically improbable. It just doesn't make any sense at all that it's been stuck there for a while. I think some more testing will show that that's statistically impossible, not just improbable, and I think we'll find lots of cases once we start testing. Thailand, hey, they're simply referring to it as viral pneumonia. That's clever, but I think we know what's going on there. The CDC plans, which we just outlined today, they call for the same things we've seen elsewhere already. That's closed schools, that's limiting mass gatherings, it's self-isolation. You need to prepare for these outcomes, and that's what we're doing over at Peak Prosperity is putting together all the things you might need to do in order to prepare, because it's such a huge list. I'm really sorry that we're here and we have to try and figure this out so quickly and on the fly, but there are enormous amounts of preparations, and you're all going to have different considerations. Some of you have cats and dogs that are on medications, and you're going to have to think through their food, and some of you have kids, and some of you have elderly parents you're taking care of, and some of you have jobs that require really long commutes. Everybody's got a story, and each story is going to have its own sort of preparation wrinkle to it. So it's a lot to think through. It really is. The economic damage, it's just going to be severe. The reactions we're seeing in the markets have nothing to do with the actual deaths. It has nothing to do with how we might compare this to the flu. It has everything to do with the lack of herd immunity, how quickly it's sweeping, and that we're going to have to balance those three things out in the big three-way balancing act. And if we're going to contain this at all, like China has managed to do, you really are going to have to expect that a lot of those NPIs are going to come into play, which is closing down of all sorts of mass gatherings, which really shuts down daily life, disrupts it enormously, and things like that. That's the only way to really begin to get this thing contained. And all we're trying to do is buy time until we can get that vaccine out. And a lot of you have sent me things about vaccines, and there's a company that says they've already got one and is shipping off to trials. And I just want to let everybody know, not here to dash hopes, but we have to be realistic about this. There's a reason we do testing of viruses and vaccines and things like that, because A, sometimes they don't work, so the efficacy is zero, or it's really low, or it's not helpful, and we have to keep going until we find a better one. Sometimes there's safety issues that come up. Sometimes they actually do the opposite thing than you think. They don't confer immunity. They actually harm you. And finally, sometimes they're just not stable. The compound or substance that's being used really just is too unstable to be a useful antiviral vaccine component or something like that. So there's lots to work out. We're going to have to try and shift the curve to the right, as the CDC said, for as long as possible to give ourselves that year or 18 months until a vaccine is developed. We won't have one in a month. And look at what's just happened in the last week, right? So we are going to need to plan as if this thing's here, and because it is, and do the best we can to manage that. All right, that's all I have for today. Thank you very much for listening. We'll be back with you tomorrow.
Hi folks, Adam Taggart here. Chris Martinson and I are the co-founders of Peak Prosperity. If you want to get alerted whenever we release a new video from Chris, just click the red subscribe button right beneath the YouTube video player. Once you've done that, a little bell icon will appear right next to it. Click on that bell. It looks like this. And that's it. The next time we publish a video from Chris, you'll immediately receive a notification from YouTube. Thanks for watching our videos.